Choose disease, brucellosis. Brucellosis is a zoonosis of worldwide distribution and is endemic in certain parts of the world, including several Middle Eastern countries. In endemic areas, the prevalence is high and attributed to widespread animal husbandry and to traditional consumption of raw milk and raw milk products. Human brucellosis may be caused by one of the following four species: Brucella abortus, Brucella miltensis, brucellosis, and Brucella canis. Brucella miltensis is the most virulent and the most invasive. The disease affects organ systems rich in reticulin endothelial tissues, with the musculoskeletal system being the most frequent target sites, presenting as myalgia, arthritis, fever, lymph nodes, and spleen enlargement. Clinical features: brucellosis is a multi-system disease that can have acute, subacute, and chronic manifestations, that presentation of which can mimic several diseases. It may present as fever of unknown origin. It is generally underdiagnosed, underreported, and mismanaged. Histopathological finding: Brucella organisms are small, non-motile, non-sporing, flagellate, gram-negative, bacilli that are shed in excreta, urine, stool, vaginal discharges, products of conception, and milk of infected animals. When they gain access into the human body, they ultimately localize within the reticulin endothelial system, where a small granuloma may be formed. The granulomas are non-casting and are virtually indistinguishable from other granulomas. These granulomas may regress and heal or progress and cause tissue destruction and abscess formation. The period between initial infection and appearance of clinical symptoms ranges between 1, 2, and 3 weeks, but much longer periods have been described. Diagnosis: clinical fever, arthralgia, myalgia, arthritis, hepatosplenomegaly, and rare otitis. Serologic: usually more than one test is performed to establish the diagnosis and to define the stage the disease, that is acute, subacute, or chronic. Tests commonly used include enzyme-linked immunosorbent assay. It is the most sensitive and rapid method for diagnosis of a human brucellosis. Counter immunoelectrophoresis. It provides rapid and sensitive tests for confirmation. The Rose-Bengal play test. It is fairly sensitive, specific, and economic agglutination test. All of these tests can be equivocal, and the diagnosis in these situations is established only by clinical presentation and is a result of Brombett's clinical response to anti-brucella treatment. The principal rule in the treatment of brucellosis is that the use of combination regimen of antibiotics to avoid relapses. Tetracyclines, doxycycline 100 mg twice daily in combination with ciprofloxacin 500 mg twice daily for a minimum period of 6 weeks, has proven to be effective. In pregnancy, doxycycline and ciprofloxacin are to be avoided. Rifampicin proved effective 300 mg 3 times daily for 6 weeks. In children, rifampicin is the antibiotic of choice. Of the dose is calculated according to the body weight. Pathological reactions: 2 types of pathological reactions take place in brucellosis. Pathological process similar to other infectious diseases. This type respond to combination of antibiotics, immunopathological process. This response to steroids. Combination of antibiotics and steroids should be used in cases that do not respond to antibiotics alone. Preventive measures. Brucellosis can be eliminated completely by immunizing animal sources, public education, avoiding consumption or contact with sources of infection such as milk and milk products. Veterinary surgeons should avoid attending herds of cows or sheep when they are in labor without taking precautions of infection from products of conception. Education of the public can be done by imams on mosques, professional health organizations, and authorities through newspapers and other media available.